Mesdames et messieurs, welcome to another episode of the Scrubbed In series, where we dive deep into the journeys and minds of people shaping healthcare. I'm your host, Tarek, and today's episode we scrub in with someone of those rare minds who seamlessly blend surgical mastery with a global perspective. Dr. Laurent Ganry, it's an honor to have you with us today.
Thank you very much. Appreciate your invitation. It's great.
Of course. Dr. Ganry is a maxillofacial surgeon trained in France, refined in Japan and in the US, and grounded in a philosophy that places the patient at the center of care. Whether he's tackling oropharyngeal tumors, leading congenital reconstructions, performing facial feminization, or mentoring the next generation, he moves with purpose and precision. Now, Laurent, you have an interesting journey, a lot to unfold and to unpack. Let's start from the beginning. What first drew you to the specialty of maxillofacial surgery?
Oh, but thank you very much for the kind introduction, Tarek. It's great. Yeah, in fact, it's complex because, as you said, I'm from different places. But what drove me to the Max Face area was, in fact, because it's shiny and nice, as I can say. You can see what's once work because it's the face we're speaking about. So when I was seeing, amazing surgeons doing cardiovascular complex surgery, or neurosurgeons repairing the brains, or general surgeons saving life, repairing, like a bullet wounds and things like this, it was amazing. But I was always thinking, like, it's funny, nobody can tell what they have done inside, and I just the people around them know they are great, right? And the patient is obviously very happy to be here, but it's different. The face is very different regarding this. It's a little bit like the hand surgery. You can see there is a tremendous problems regarding functions. The face, you swallow, you speak, you breathe. It's a lot of things you do with your face and your mouth, and in fact, so I was driven by that, by the fact that you have also the obligation to give back some dignity, and to make your scars a certain way, and to try to make it look good, basically, on top of making it essential for quality of life. So that's what drove me initially when I started medicine, because back to France, maxillofacial surgery is a medical specialty. I was driven by doing reconstruction, but at the time I didn't know what it means. So I was, in my mind, the plastic reconstructive surgeons would be what I wanted to do, but just by medical studies and being in the hospital and in medical school, then I discovered the max face specialty that is a little bit less known. But when I saw what they were doing in details there, I was like, this is what I want to do.
Now, there's a statement that I read you mentioned before that the face is at the heart of each person and in their personality, and I kind of see what you mean by that. Now you've explained what drove you into your passion into maxillofacial surgery.
Oh, yeah, yeah. You went to my website,
Yeah,
huh?
I did some studying about you.
Oh, that's great. Oh, I can tell. No, no, I love some quote like this because, I mean, it's amazing, right? We are 8 billions people, maybe more now on Earth. Not a single one looks the same. Is it not crazy? I mean, this is really amazing, right? And except real twins, obviously. So when I was also seeing some mentors doing always the same surgery for the same facial procedure, such as, I don't know, a nose job, for example, always the same rhinoplasty technique, always the same facelift technique, always the same way to reconstruct a jaw or an eye or whatever. And so this is interesting because not a single patient has the same nose or the same face or the same baseline, skin color, everything you want. It's completely different. And the gender on top of all of this, or the age. You don't even have the same face yourself from your 6 years old to your 90 years old. So it's very interesting. But so I love the idea of also refining depending on all of these criterias, right? About you have to have multiple techniques to answer the patient's specificities and concern. Um, I was also, you know, given a very good advice when I was young. Um, I was 18 years old. I have two older brothers, and basically they are smarter than me by far. And so, so I was like, they tried medical school and they didn't like it, or one tried 2 years and they said, nah, it's not for me, and one tried even 6 months and it's really not for me. Now they're very happy. They're doing completely different things, right? But the reality, I was if they didn't like it or they fail, I'm not going to do this. But in fact, I was afraid not being successful, and someone told me something very nice, because I wanted also to be a jeweler. That was my main passion, except biology and taking care of human being, basically. And I was like, maybe I should become a jeweler, because my bro, they didn't like medicine, and this person told me something very great. She told me, like, you should start by the thing you cannot do as a hobby. And I was, what do you mean? Because yeah, if you're successful surgeon or whatever you want to become, you're gonna be doing jewelry on the weekend when you will be grown up. It's possible that you mix both and you will have both. That's great. But if you start by jewelry, or you can do a maxillofacial surgery in your garage on the weekend. So you better start by the stuff that maybe give you opportunities to increase your hobbies list and all of this. So that's also why I decided to go in this on this pathway.
It's interesting that you have a hobby or interest in jewelry, and maybe that also explains a little bit of your artistic side in your in your surgery, right? Because you do a lot of reconstructive work that needs some new thinking.
Yeah, that's my main thing is reconstruction. You're right. Um, I think it's funny because life drive you exactly where you need to be. It's very funny how there is a way that you decide things, and at the end you end up exactly where you belong. It's a rough pathway, but at the end it works. Because yeah, indeed, if you think closely, the most close job to jewelry is dentistry. I never put a foot in dental school by my training, but I had to learn the dental aspect of things, because when you repair oral cavity, you have to understand how the occlusion works. You have to understand how to repair things. You put dental implants. You put all of these kind of things to do dental reconstruction on top of the oral cavity reconstruction. So it's funny how life drives you like this. And indeed, when I do microsurgery, I use a pickup called a jeweler. It's a microforceps, for microsurgery. It's called a jeweler. And so, and
Jewelry,
when you,
wow.
well, yeah, it's funny, huh? And so, when we use our screws and plates, obviously far away from your world, where you have to repair the extremities, the ribs, the spine, whatever. But the iliac crest, all of these kind of things. Me in the face, I have screws of like 1, 2, 3 millimeters length. It's ridiculous, but it looks like jewels. It's very, very lovely. There is the green screws, the red screws. It looks like emerald, ruby, a sapphire. I mean, it's very funny.
So you already got that.
Yeah, when I entered into this world, that's it. That's exactly what I like. So yeah, yeah, I like jewelries. I like also, the little things like some Legos with my kids. These kind of things when you build, and you construct. That I love. That I have to say, I have a tendency to appreciate it. There is a part of art, obviously, but it's not exactly what you think. It's not necessarily to be gifted in art, but there is a thought process about art in the face that you need to understand down the line. Yeah, there is a little bit of connection.
Wow, impressive.
Well, it's funny how life drives you, right?
Yeah, I love that when you said, life drives you to where you belong, just takes you where you need to be.
Trust the process. Obviously, you have to make good decisions, but it's about happiness. And so, the problem is, we are teach to try to hold from happiness because we need to provide, we need to, be successful, we need to, many things in life, right? But in fact, if you keep the happiness at the center as much as you can, but it sometimes means sacrifice, then maybe a little bit of luck, maybe 10% is luck, but the rest is in fact you. And honestly, it will be worth it. But you have to see the long run. I mean, I'm still young, but obviously this kind of thing happen in the very long run after decades. So this is why you have to trust the process. It's a little bit complicated when you're very young. So, but there is hope.
So you trained in France at the Sorbonne, and then you trusted the process, as you mentioned.
Yeah, well, I was not aware. I was not aware there was a process.
You realized there was a process later
Yeah,
on,
I realized that.
and you became an attending at one of the top cancer centers in the world and in Europe, the Gustave Roussy.
Oh, that's correct.
You worked there for a while,
Yeah.
and were you dealing there with the majority of cancer patients, like oropharyngeal tumors?
Yes, it's when we say head and neck cancer, the thing is it's encompass of a wide variety. In fact, it's everything above the collarbone and below the skull base. I like to say it's from dura to pleura. It's exactly what it is. And so the problem is OMFS, oral maxillofacial surgery, which is not very common specialty, well known, like OBGYN or orthopedics or ENT, here nose and throat surgeons. OMFS really means specialized in oral cavity and your face. So everything, in fact, you can see from one's face, mouth open, basically. So till the tonsil, till the soft palate, what we call the oropharynx, basically your throat. It's what is behind. But there is also the sinus, the nasopharynx, the hypopharynx, the larynx, the thyroid. I mean, a lot of other things encompass in head and neck. So when I was at Gustave Roussy is number one cancer center in Europe. It's usually the number four in the world because the first three are in fact in the United States. It's MSK, it's Anna Farber, it's Mayo Clinic, it's MD Anderson. This kind of place, obviously. But when we say the best in Europe, it means that they are at the top notch of the research. It means that you have the new molecules, you have all the clinical trials, you have obviously a fantastic team of surgeons, obviously, but also med-onc, red-onc, all of these people taking care of cancer. So it's obviously a team effort. It's more than just one person. It's never, when you're a surgeon in such institution, you're not Dr. Ganry or Dr. Tarek Krizat, it's about you're the doctor of the institution. You're Gustave Roussy surgeons, you're MD Anderson surgeons. It's a little bit more like this. So I was in fact the only OMFS in the ENT group because in ENT you take care of the back of your throat, the oropharynx, the nasopharynx. So, but not a single ENT will master everything. It's impossible. So one will be specialized in robot surgery to go by the mouse and remove the tonsil and the pharynx tumor. One will be specialized in the nasopharynx and the sinus with a scope to clean the tumor endoscopically, basically. One will be more general, removing bigger tumor of the oral cavity, the throat, or one will be just for the thyroid. Well, it's exactly like me. I'm just the oral cavity and the face, including the skin, obviously, of your face. That's in fact my main specialty, the skin tumor. But anyway, the this is how it is. So I brought my scope of OMFS regarding full jaw reconstruction because obviously when you're an ENT, you have excellent training in cancer, not usually as good in recon as OMFS or plastics, because we are more about bones and hard tissue and these kind of things, and also the trauma. So we are used to place titanium and screws and things like this. And obviously the dental rehabilitation, which is a main problem when you remove a big tumor in your mouth, you remove a lot of teeth, basically. And that's the main problem for the patient. They all want dentition back, so denture, I should say. So the what I brought was all of this scope of refinements, basically, as well as the skin because they were missing a skin guy. So I was like that. I had a great time. This team is amazing. And also, I also broadened my scope because I was doing some larynx, some thyroid, some other things, some more pharynx with my ENT friends. So I was really like becoming a true head and neck surgeon thanks to this exposure. It was really a good time, plus being obviously on top notch of what needs to be done for cancer treatment back to that time, 2022, when I left. So it was really really nice. It's a very good place to go to.
Wow, and you mentioned that patients uh, they undergo major operations and they need a lot of reconstruction, requiring bone, flaps, etc. And reading about your research and background and publications, you seem to be an innovator as well in the field of reconstruction using 3D
Yeah.
molds and AI. Was it jewelry who started all this?
No, but it's in fact one of the main things that also drive me to MFS was in fact this technology about virtual surgical planning and 3D printing technology. In fact, when I was a resident, there was barely access to this kind of thing. It was really the new era, kind of. And so basically, what we do, you have to understand, like the face is a very very compact and complex bone organization. It's really really unique. In fact, it's like full of air inside, a thin bone, sometimes white bones. There is nerve into the bone also. There is, as soon as you touch the mucosa in your mouth, well, you're straight on the bone, so there is always bone involved. Inside the mouth, you have to reconsider the inside but also outside the oral cavity. When you're on the face, it's usually soft tissue only. So we have all of these nuance that really help us to have a lot of reconstructive refinement and innovation. When you do, for example, just lower extremity reconstruction, which are very complex, I'm not saying anything there, but the problem will always be the same. You have to resurface the soft tissue, and sometimes you have to place a tiny piece of bone. So the only innovation to do is to make reconstruction where you grab a piece of tissue of the patient and you place it back to the defect, the hole to reconstruct, as thin as possible. That's the only really big nuance there. But us, we have all of these different components in, out. The function is it mucosa, is it skin, is it bone? How do you reconstruct the nerve on top of that to feel your face or move your face, because you also have the parotid system with the facial nerve to reconstruct the facial paralysis. When it's the brain, when I had my neurosurgeon friends, how do you close a CSF leak? So the problem is completely different, like, right? We want to do something to save the patient, but the goal is just a mass to close a leak of CSF when they do brain surgery. So it's really very very interesting because there is a lot of different nuance and it's very dense in a very small place. So we use a lot of virtual surgical planning to help us. So it means that, for example, if I take the most classic example, which is a cancer of the lower jaw, the mandible, and I need to remove the mandible inside the mouth without any scar, obviously, to really remove the tumor. That can be a benign tumor that we see a lot in OMFS or a malignant tumor, obviously. Then the thing is, how do I reconstruct you? Well, I'm going to take a piece of bone, usually from your leg, and I'm going to repair your jaw with a bone that is alive, like a transplant of yourself to yourself. It's like a kidney transplant. It's a piece of bone with an artery and a vein, called that a flap, a free flap. And basically, we reconnect the blood flow into with a tiny little incision there, and just to connect the vessel to a vessel of your neck, and it's alive. And so with this piece of bone, I can place screws, dental implants, and then I can place a denture. We call that a jaw in a day surgery. And basically, you go to the OR with a tumor in your jaw, you wake up with a new jaw and new teeth in your mouth. And that's just amazing. But the precision required there is so high because think about it. You move just 1 millimeter of your jaw in your mouth like this with your teeth, you can feel a difference. Well, when you break your arm, you can tolerate 10-degree angulation, let's say, it's going to be okay, right? So this is inframillimetric precision in your mouth. So that's the problem because the teeth are so sensitive about this tiny nuance. Plus the face, how does it look like, right? So this is why you need guidance by a virtual surgical planning, which means that you perform the surgery on a computer. You cut the jaw, you place the bone, and then you produce by 3D printing technology guides that are obviously sterilized, and that in the field during the surgery you place, and they tell you exactly where to cut as following the plan you have decided, and then where how to cut the bone of the leg, and where to place the implants of the teeth, where how to place the dentures. The denture is also 3D printed, right? Using the scan in the mouth that we do. It's a oral scan, we call that. It's like a lot of pictures, and then you can reprint the exact dentition of the patient, and then you connect all of that during the surgery, and up, voila, you have a new jaw. But manually, it's impossible. Plus, can you imagine the time you win doing so during the surgery? It's amazing. So surgeries that were when I was start my residency manually done, uh, 12 hours sometimes surgery. It's crazy long. Become now
12 hours.
surgery. Yeah, that was before. Now it's 6 hours. It could be 5 hours and a half with a great team. So for a simple surgery, as I told you, I say simple because sometimes it's way more complex. So, but and sometimes you even have to do two transplants at the same time. I mean, you can imagine. But now we have really these tools, and that's just great. And where I'm working, we have full access. We even do that in house with our own resident. And for example, just yesterday, I had a facial trauma on a baby girl of 3 years old, unfortunately for her. But what is great is on the CT scan we received last night, I know it's cooking already in my 3D printer in house this morning in my department. The full jaw of this baby girl is printed, and then I can use it on Monday tomorrow to repair a jaw for a trauma by creating a splint on this 3D printing model. So it's just amazing. In one day, you have access to something called
Impressive, yeah.
extremely high precision. Yeah. So the field completely changed. This is also why it was interesting, and I work a lot back to France about how to make it in house because for $15 you have like a jaw printed. It's because
Really?
it's
Wow,
exactly,
that's
yeah,
impressive.
because you don't need to sterilize it for this specific case I just told you. You just need a a model to create something that's gonna help for the fracture repair. So that, and this thing's gonna be sterilized. So the model can be, it's just a pure melted plastic piece. So you don't, that costs really $15. So that's amazing. So it's really, and it's so fast, right? It's just right, just like that on the weekend, right?
I mean, it's impressive that you're saying, how 3D, how technology has helped us, achieve high degrees of precision. Because I wasn't sure, or I didn't even realize that, facial reconstruction would require, or there is no room for any lack of precision in it. As you mentioned, like the balance in the face and everything is important.
It's one of the most precise things you have to get. Yeah, for sure. A hand, for example, is also extremely complex. However, a hand's number one priority is function, right? So you can tolerate a lot of things. And but now people now by 2025 now they are also concerned about the cosmetic outcome of the hands now. But when I was training decades ago, it was really like we don't care how it looks like. At least it needs to function. And so now, obviously, with technology improvement, now everybody also focus on it needs also to look good. And the reason why is because if you have now a mechanical hands, well, it's not so bad sometimes. So people are fighting against that by improving the surgical skills. So the face, there is not too much of robotic right now to replace. So we really have to work with the patient tissue, and this is how we get very, very, very precise at some point. We can even regenerate your jaw, for example, now.
Tell me about that.
From, yeah, for example, in the orthopedic world, people have like sometime defect in their bone. Let's say the lower extremity, you have like a massive fracture, and they have to remove a piece of your bone, a few centimeters. Let's say your tibia, so they fix your leg, with an external fixation device, and they wait So there is a concept by a French surgeon, in fact, Masquelet, his name is exactly. He's still alive, but not working anymore. He's retired. He developed a concept called the membrane concept, where basically he is going to preserve some different type of membrane. He uses cement first, create like a pocket, like a nest, and then he gonna bone graft, removing this cement, and then the bone gonna regenerate basically. So rather than bringing an alive piece of bone, which is a heavy surgery with a certain donor site morbidity, right? We can also regenerate your bone by just bone grafting the defect. And so what we do is now we 3D print a titanium bar that is like a crib, a little bit where there is a gap. There is a tiny crib of titanium, and then like that we place it, and then we place a bone graft into this crib, and your jaw gonna regenerate. And so it's different approach. There is a multiple stage procedure. You cannot have your teeth right away. There is pros and cons in both worlds, but we can also do that. And when you regenerate the jaw, the nerve can regenerate. Some
Wow.
pediatric case have even new tooth regenerating in the regenerated bone. It's just absolutely fantastic. So sometimes
That's
it's just
insane.
amazing. Yeah, it's just insane, like what the body can do. And so we use growth factor obviously to help, like bone growth factor called BMP, these kind of things. We use your stem cells. We use some decalcified bone. I mean, a kind of a savant mixed cocktail of all of this. But thanks to the 3D printing technology, we also create a crib like this of titanium holding all of that, and a lot of cases are successful. The problem with the oral cavity in the face is that you have to avoid infection. So this is why it was not very popular. But now we are managing way better this kind of things. So, for example, we go only by the neck, and like that, we don't go into your oral cavity, this kind of things. And then we are able to do that. So some patients they prefer these solutions. So we have many tools now, and it's just the advancement of the technology that help us to do that.
Wow. And now you were talking about the 3D printing and all of the molds that are used. I just realized that you're not using a standardized mold, one that fits everyone. You're creating
No,
something precise for everyone.
no, yeah, that's exactly what it is, right? 8 billion people's not the same face. That's exactly
Right,
what
right.
it is. So now, obviously, you can find a good enough precisions. For example, I'm less lean than you, and so my angles may be a little bit, more. I mean, less important, right, regarding the bone, because you cannot tell exactly the angle of my mandible where it is. I mean, if I miss 2 millimeters, what's the difference, right? Some areas are obviously okay, where you can have a guide that fit them all. But the problem is, in fact, people get confused because at some point you work in a certain population. So when I was doing a lot of webinar, for example, when COVID hits, I was presenting my result. There is some group when of reconstructive surgeons, so we like to share every weekend like that for many years now. It's like it's a very good group of people around the world. So when I was presenting my case, the question was all the same. Yes, but in our population, for example, in Asia, you cannot do a lot of big scar on the face to refine because they're gonna do poor healing, like keloids and hypertrophic scar and all this kind of thing. So it's very interesting that depending on where you're coming from, also you have to adapt, and there is a cultural belief also. So yes, you can fit them all, but sometimes you have to switch completely because some patient will not allow you or will be very annoyed by the fact that you're going to create a scar in their neck or a scar on their face, whereas some other population doesn't mind at all or will have invisible scars because they heal well. So all of these kind of things matter, in fact, yeah, to have the best possible outcome as a patient-centric approach. This is really what I believe. Is that really what do you need, you in your particular scenario, which is completely not what your family member here present in the room would need if you had exactly the same problem. Yeah, you have to adapt, right? It's depending on your age, your gender, your face, your culture, the disease, obviously. and you have to switch gear depending on what can be done. Usually, I have five possible solutions for one single problem, but which one is okay for
Is the
you? And
best.
this, yeah, and in fact, this is the art. This is where the art is. I
The
told you
jewelry come
like,
in.
yeah, no, but this is where it is. In fact, the technique is a technique. I'm sorry, but a lot of people think like dissecting is a technique. Well, at some point, yes, but at some point, it's standardized in your hands. You have your ways, and that's it. So now it's just reproducing the same. So the real art is not there. The real art is what technique you need, to make you look good and to make you look work. I mean, function well. And that the art, that which one will need this technique that is more challenging for me but better for you, and then the technicality of it, yes, but not really. There is like a very minimal amount of art after that. It's exactly like, if I may, fillers, simple fillers, right? Everybody knows fillers, hyaluronic acid injection. I do that all the time, and so because I can repair a lot of things from the cancer or the trauma, but also for the cosmetic world. Well, the art
Cosmetic
is
part.
to, yeah, it's a cosmetic part, right? And so because you have a real cosmetic only aspect in the face, right? And so the good deal will be simply, what do you need to look awesome or to look attractive? Completely different discussion there, right? But the reality is like, the way I'm going to inject your cheekbones or your eyelids or your lip basically is roughly the same. But now what I'm doing is, I need to evaluate, do you really need this or that or that? That the art. Because the technicality of doing it, well, you mark lines on the face of your patient. So it's going to change depending on your patient anatomy, right? The marking, the lines, where to inject. But as soon as you know where to inject, the technique is the same. So this is not the art, the injection part. But do you need it? That the one, that the most difficult one to guess.
Now, I'll catch up on that point of the art part in a minute, but I wanted to, you mentioned something about, respecting and appreciating the cultural differences of the patients. Now, in your journey, you moved from France to Japan, which is quite interesting, to
Yeah.
continue your further training over there at one of their top institutes. What was the moment that made you make such a big decision, such a big leap?
Yeah, well, in fact, it was, I had nothing else to do at the time. So no, the what happened is that after my residency, before becoming a young attending in France, I decided to come to the USA first, just for a fellowship. And that's where my life completely changed. I went to Florida, Jacksonville, with a guy named Rui Fernandez. He's what we call the Da Vinci in our field.
Wow.
He's the most amazing humans you can have. I mean, I'm obviously biased because I know him very, very well, but he's the best mentor you can have. So I was really extremely lucky to have him, and to be selected to be his fellow. And so then, American years start in July, right? But in Europe, it's in November. So from July, at the end of my fellowship, to the next year, November, to come back, I had nothing to do. And so I told myself, what should I do? What should I do? And there was this guy in Japan, in Tokyo, named Takumi Yamamoto. He's a young guy, but he's a monster in the field of very tiny reconstruction, as Japanese people probably appreciate very much. It's a cliche, but it's really true, in fact. And so he was doing what we called super microsurgery. So it's very
Super
pompous
micro.
term. Yeah, it's not humble, not really, but it is what it is. He was connecting vessels that are so small that nobody thought it was first technically possible, but also what's the point? But in fact, he was treating all lymphedema thanks to this. The lymphedema, the accumulation of fluid in the lower extremity after breast cancer in your upper extremity, um, were never dealt with any type of surgery before, just massage and compression band, and that's it. And in fact, this guy was surgically repairing the lymphatic vessels together by bypassing them into the veins. And so he completely was treating everything. So this guy was the guy to go to. I don't do lymphedema surgery, but he teach me how to get super small and not being frightened by that. So I went roughly 6 months in Japan to learn next to him. And in fact, thanks to him, I was able to refine my reconstruction in the head and neck, typically by doing extremely small reconstruction. For example, I can take a piece of your ear, from the anterior aspect of your ear called the helix. That's a perfect nose. That's an absolute perfect nose, for your nostril recon. But now I can detach it and make it a live transfer as a free flap. And because the vessels I'm going to connect are the tiny vessels, next to your nose, it's like, I don't know, half a millimeter diameter. It's extremely, extremely small, but it's
Tiny, yeah.
possible, tiny, tiny, and it's possible. So I'm using the super micro skills now to recreate, some very difficult scenarios of reconstruction, because in fact, smaller the defect, harder it is. In fact, it's easy to reconstruct a big hole, but a tiny hole with a lot of nuance and very cosmetically important is the worst you can have. And a young patient on top of that, can you imagine? You don't have any skin laxity. A young obese patient, even worse. You really have no capacity. A skin that can do hypertrophic on top of that. Oh my god! So it's nice to use these kind of techniques. Thanks to Takumi, I am able to. In fact, I have refined a lot of thing in our world thanks to that, and he gave me my notoriety. In fact, so this training was life changing for me for sure. It was great to live in Tokyo for 6 months. It was just awesome.
That explains
That was
your
the best seafood ever.
yeah. I wanted to ask you because not everyone gets to train in Japan. That's a very unique thing, part of your journey. Yeah. What were the biggest cultural and clinical differences from training in France, going to the US, and going to Japan? There must be something
Oh my
different
god.
you've experienced
Oh
everywhere.
my god. It's very different. So in France, for example, we are. I mean, the cliche are true. We are a little bit about ourselves, and so when you train in France and you're even doing good stuff, you barely get a good job. You barely get it. It's absolutely not cultural. When I arrived in the USA, the first time someone told me, good job, it was really good today, I was thinking they were laughing at me. I
Oh.
was like, why are you telling me this? I mean, I said, no, because it was a good day. So I understand for the first time, oh, that's a cultural differences for sure. Because they were really about team, USA, it's about team working, all these kind of things. Very different in Western Europe. And then when I went to Japan, it's oh my god, it's very different. So, for example, the most interesting story I have to tell you about cultural differences. First, there is a clear private bubble around each individuals. You cannot touch a shoulder. Me, I'm by my personal French culture. I have a tendency to put the hand on the shoulder when I'm speaking with someone, speak with my hands a little bit like an Italian, let's say. So that's very normal for me. We French kiss to say hi. I mean, we have no issues with contact as a cultural thing if it's appropriate, obviously. In the USA, it's a little bit less, but still, it's perfectly okay to tap the shoulder of someone, say good job today. It's perfectly okay. In Japan, you should never do that. Absolutely not. But also, there is a very weird, for me, not for them, obviously, but for me, a very weird nuance in respect. And so, for example, one day we went to the war and we left at noon. No, sorry, at noon, at midnight. It was full blown day surgery from 8 a.m. to midnight. No rest, no nothing.
Wow.
Very difficult case of reconstruction, whatever it was. But the day was terribly heavy, and 1 a.m. finally the patient is in the PACU recovering. Everybody say, "Hey, good day today," obviously, la la, and have a good one. And I remember very clearly Takumi Yamamoto, the chief, telling me with an eye contact, you should rest tomorrow. You should take a day off because obviously you're here as an extra.
You did
It's
an
really
extra
good to
day.
have you. Yeah, but take a day off. Enjoy Tokyo. Enjoy your day. It was like a free Friday, something like this.
Yeah.
I was, oh, okay. Thank you very much. Are you sure? Yeah. Well, okay. Okay. Well, thank you, boss. Thank you, sensei. and I was on my way. And I remember the chief resident, when I was crossing the door to leave, telling me, Laurent, come back, come back. And I was, what's going on? Said, you have to come tomorrow. No,
Wow, really?
I mean, you clearly said, you heard Takumi saying, giving me a free day. I said, no, no, no,
Yeah,
no,
have a
no.
good day.
If you come tomorrow, it will means respect because you really wants to be there, and he will be very, very happy about that. That's very, very, very wrong. The approach of all of this was, I was like, okay, well, I can be there tomorrow, no problem. And indeed, I was there tomorrow, and the boss smiled very much because it was respect to sensei. So that was interesting, to give a free day to someone, hoping he will come next day regardless. Very interesting cultural differences there. But yeah, I mean, but still, I ate my sushi and I was happy, so no
Very good.
problem.
I mean,
Uh,
so you had a full day of work until past midnight, and then you had to come in the next day. You can't beat the Japanese culture of perfection. It's like
oh, no, no,
out of
no!
this world.
They are the best to give themselves work. That I can tell you. That's really the work. I mean, they have 10 days of holidays per year. So when I came between July and November, I was there at summertime. And at summertime, obviously everybody was taking their holiday, their week of holiday. And so
Wow,
they were so excited to have a week off. And I was, of course, it's hard in the
crazy.
USA. It's less hard in Europe. But I was like,
Right.
wow, that's really short. When you work as hard as that every day, this is short, just a week for surgeons for sure.
They're like work
So
machines.
yeah, they have a work culture that is extremely hard, and they really live through this. So yeah, it's very challenging. Very challenging to. Well, there is a lot of social reasons behind that, but indeed, I was thinking it's hard. It's a harsh environment for surgeons there, but they are happy. They are happy because they are like successful in their job. So when they are successful, no problem. Yeah, that was interesting. So travel make you, I would say, less dumb. Travel make you smart. Travel make you understanding differences for sure.
Opens your eyes and new perspectives and new
Oh, for
horizons
sure,
for sure.
for
Yeah,
sure, for
yeah.
sure. You understand way better your patient after that for sure.
So you mentioned while you were back in France, you were managing mostly cancer patients, and then
Hmm.
you also do reconstructive work after dealing with the cancer procedures.
Yes,
You do also some cosmetic and plastic facial procedures.
correct.
Now, you'll tell me about your plastic facial work, but also how do you manage to balance all of those things? I'm pretty sure it takes a lot of skill, a lot of
Yeah, yeah, you're right.
ability to master all these three things.
Yeah, correct. Because when I arrive in my new position here in New York, in fact, if you look on the website of my new position, I have the three privilege in three specialties. I am OMFS, I am ENT, and I am plastics. That's
Wow.
because my training was through that. I have the three diploma basically, and so I was a fellow in ENT in the USA, also in Harvard. So you see that I have a weird pathway for sure. I am not a classical MFS because of all of this. But anyway, I always consider that you cannot make a full nose reconstruction after a cancer of your nose if you don't know how to do a cosmetic rhinoplasty. Makes no sense to me that someone that doesn't even do rhinoplasty cosmetically will reconstruct your nose. Makes no sense. Same for the ears, and from the eyelids, and from the oral cavity, and the rest is really soft tissue. So for me, cosmetic and recon is two brothers. That's for sure. They are like completely linked. In my field of MFS, you can do other things. You can do orthodontic surgery, which will be a surgery of your jaw. To change. You break the jaw, and you change the position to make your teeth look good and your occlusion look good, as well as your facial contour and appearance looks good. It's a completely different realm. And then you have also the TMJ, for example, the joint, where you go with a scope into the joint, and you release the problems of the joint or repair the joint. That is also a completely, there is fellowship only for that. Then there is a sleep apnea world when you can also deal with all of this, because it's all about occlusion and mouth guard you have to wear, and then it's about removing the tonsil that an OMFS can do, obviously, and then final surgery step is orthodontic surgery. So to advance your jaw and like that, you don't have sleep apnea. So you have a lot of different things like that. You have all the dental recon purely with the implants and all of this. So you cannot do it all. It's impossible, right? So it's exactly like an ENT. I told you that is specialized in the nose, or the other one on the throat, or the other one on the thyroid. In OMFS, we are also split like this. And in fact, in plastic, it's the same. You cannot reconstruct the breast, at the hands, at the face. It's impossible. You have
Right.
to choose,
Yeah.
right? So in the realm of different things you can do, I really thought first cancer was my main topic, but then I discover I have maybe something different to offer as a reconstructive surgeon too. So I do both. I do resection and reconstruction, and I work with two partners. I can do both too as OMFS. So it's very nice because one day we have a cancer. We have, for example, two major cancer next week. And I know in the morning, we're going to say, hey, what do you want to do today? Do you want to resect or do you want to reconstruct? And we're going to shift like this one another. And it's very nice because you keep,
Tag team.
you keep the day go on and you do different things. It's very good. And, um, and so this is why I thought so. I was lucky because in France, OMFS are usually division of plastic surgery, and so this is why I learned a lot about plastic cosmetic things, because I was in other craniofacial meeting in for the pediatric, the cleft that we do a lot as OMFS, and I was in the burn center, sorry. So taking care of facial burn for pediatric and adults, and then I learned the facial cosmetic purely because I was young attending initially in France in a plastic surgery department, but the chief of the department was Max Face. So I was one of the Max Face doing the cosmetic of the face, because the Max Face wears the face in the department, and there was the plastic for the hands, and the plastic for the breast, and plastic for the belly, and the plastic for the gynecologic area. I mean, this is where I start. So this is how I learn all of my stuff, and I think it's a perfect combo because I can really think about how to make you look good at the same time at doing an important work of reconstruction, for example.
Wow. So, I mean, Laurent, is there anything that you don't do? I mean, it's like,
Uh, no, a
it,
lot. No, in fact, I don't do orthodontic now because my colleagues are genius doing only this. So now I don't do orthodontic. I barely do any dental work now. I still put dental implants in my trauma, things like this, but that or in my jaws that are reconstruct. But now you cannot do it all. I don't do the TMJ, for example. I do not do that, and I am starting back to do some cleft now. So you see, because where I'm working, they only needs. So why not? It's
why not?
interesting.
Exactly. Yeah.
Yeah,
Yeah.
because I had all of this previous training, and we go as a team. Obviously, it's not a single man thing. But indeed, I'm a little bit unusual about the scope. But I think this scope, cancer recon and cosmetic, is extremely connected, and I think it makes a lot of sense. But now you have to have a interest in all of that. It's kind of difficult to have interest in all of this, but because I see the link, just for example, I can do a cancer resection, reconstruct by my colleague, but I can help for the reconstruction. I'm going to follow the cancer, and then I'm going to take care of the sequels of the cancer, about facelift to make the symmetrization of the neck, about many other things with fillers. Why not? And it's very important to be able to offer all of this. Otherwise, the problem is you cannot find people with all of the skills in the same department usually. And so the problem for the patient is to have many different departments. The worst will be three. You have the cancer removed by ENT, the reconstruction done by a plastic, your dental stuff done by an OMFS, and then you go back to one of them for minor detail. They are not necessarily agree one another because it's not a single man decision, single surgeon decision. So the patient can be very confused. Um,
Right.
for example, I had a young lady with a disease due to radiation after a sarcoma, and she was treated by an ENT a long, long time ago. And I was, she came to us for this disease in the mouth, and I was okay, called an osteoradionecrotic disease, like the bone was kind of necrosed due to the radiation. And so the treatment is just to clean it. And then after that, she was complaining of some sequels from the radiation. And she was a 42 years old female. And so I can help you, but it's a stage thing. First, we make sure you're safe, the cancer is controlled, and then we go into this realm. Well, when I emailed the doctor, the primary care surgeon, about what I was offering as a treatment plan, he said no. I don't want her to take any risk. I think we should wait. And so that's the problem exactly sometimes that even and I'm okay, I just give an opinion. I think it should be helpful, but then the patient is confused. What do I do now? And so I was, well, go back to see this person, and then you discuss, and then you find a way. And if you really really want, despite everything your primary surgeon said, I'm always available. But that's how it works, right? So you have to be a team there, and sometimes you do not agree. So that makes the patient quality of care a little bit more complex, a little bit more complex.
Now, you're definitely a unique case because you have, the interest that connects all these three fields together, and especially like it's in the face where cosmesis and function is very important. And I think that what makes you skilled and passionate and innovative in this field. Which area do you find the most creatively fulfilling or emotionally rewarding?
It's an excellent question. Well, I think recon. I think recon for sure, because it's extremely satisfying to. So it's funny because in my field, you can save one's life in only two scenarios: cancer or infection. I was pesting about the infection rate because we have so many abscesses linked to the oral cavity because bad teeth basically, or problems of things done in the oral cavity. I was when I was a resident. This is a lot, and in fact, sometime I was able to save one's life with a tracheostomy and jumping on them. So even simple, treatment of an infection can be extremely rewarding. I have on my desk there some gift of people with that went to SICU, and like a nice best surgeon, whatever. It's a little thing that they can bring you sometime, and it's really lovely. And I have that for years. I will never throw that away. It's impossible. So it's funny. I still have a pen in my jacket at the hospital, offered by a patient exactly for the same reason. And I'm using it,
Wow.
and I'm recharging it. I don't want to throw it away because it's just a pen, but it's beautiful. And so and so yeah, rewarding will be recon, because even if you save one's life as a cancer surgeon, well, first, these cancers are very challenging. They are really a beast. It's the cancer of the head and neck is really a poor prognosis usually, and so you lose a lot of your patient. And so, as soon as I have a big tumor, I have one chance on two that my patient will not, go beyond 2 years. And so that's a real problem. We are still struggling a lot to have decent control of this cancer. So some of these type of cancer are extremely good, like a tonsil due to HPV virus. It's 98% survival. Thyroid is excellent too, but some of them, squamous cell carcinoma of the oral cavity especially, are the worst. And as soon as you get a little bit big, your survival is below 50% as far as 5 years for sure.
Oh, wow.
So you spend a lot of time, in the war trying to help, and the cancer is coming back. It's crazy. And so, despite everything being done appropriately, good margins, radiation, chemotherapy goes on, but cancer comes back. So it's annoying. And what I have witnessed is that the recon aspect and the dignity given by a large surgery to save life, but with the appropriate discussion that I can fix you back, um, is is something else. And the patient, yes, the cancer is in their mind, but they thank you because they look okay, and they can kiss their sons and their grandsons and their daughters in family meeting without being monsters. or drooling, or smelling bad because they have obviously some maceration or whatever. So you can even do a cleaning surgery, kind of. Sometimes even if the prognosis is bad, because sometimes the tumors smell bad, and you cannot even enter into the room of one patient. Um, so for the family and the dignity, of dying with all your loved one around you, sometimes it's appropriate. It's rare, but it's appropriate. So I think reconstructive and being able to reconstruct anything, is a true satisfying part
Rewarding.
of the job. Yeah, rewarding part of the job. And my colleague doing only resection are really happy because they know whatever they're gonna do, we're gonna fix it. No worries. So I understand what they are doing because I do it myself. But as soon as we discuss, I can design whatever to reconstruct exactly, and so give a little bit of dignity. No, it's a very rewarding job.
I fully agree with you on that. Reconstructing someone's face maintains their, you know, dignity, or because there is a psychological aspect of it. Like if you have any facial, deformities, that's going to affect you personally. It's not just
Of
how the
course.
people perceive you, but how you perceive yourself as well.
Yeah, correct.
Now, you do a lot of procedures at your practice with, under different umbrellas. Do you do purely cosmetic procedures, or only like if they are after a reconstructive work?
No, no, I do also purely cosmetic procedure, facelift, rhinoplasty, blepharoplasties, of the eyelid, just a fat removal, fat grafting of the face. So typically, a patient come to me for. So it's funny because you have to balance, right? When you're a reconstructive cancer surgeon, your goal is to choose the appropriate surgery, right? Usually, because the
Right.
answer is usually surgical. And so now, what is the best surgery for you regarding function, cosmetic? We discuss about that. But when you put your hat as a cosmetic surgeon, the reality is now I need to make you happy without going to the OR,
Right.
because there is all the realm of the non-surgical cosmetic procedure that ones need to know. It's impossible. So to manage someone just by surgical answer. Yes, it's true after a certain age. Yes, it's obviously appropriate for many patients, but a lot of them do not need to go. And so I'm amazed by the amount of patients that had the recommendation of a deep plane facelift, for example, that is very popular right now, especially in New York because it was invented in New York, in Manhattan. And so I'm amazed by the number of patients that was said to, you have to have a
Requesting it.
deep plane, yeah, requesting a deep plane facelift. So surgeon recommend a deep plane facelift, and they need in fact a minimal approach facelift. This is what they need. And I'm offering this solution with the balance that they are 50 years old, and then definitely need something because no non-surgical technique gonna work well for what they ask. And then so they are surgical candidate for sure. And then like that, I'm telling them, in 20 years, you still have the joker for something else if you want, because nothing is important. It's like having a cosmetic is like having a Louis Vuitton bag or a Ferrari. It's not needed. But if you want, you can, but it's not
You
needed. It's
can,
just
right?
it's luxury. It's nothing more than that. You don't need it medically speaking, right? So it's important to design a journey that makes sense. Like for the next 10 years, I'm managing you without surgery, and in 10 years we can do one surgery, especially the eye, that's going to make you look awesome and refresh. And the rest you don't need. And 10 years later, if you want, then it will be the time to do something more advanced in the OR. And so for the next 20 years, because you're 45 now, I'm not putting you in the OR. You don't need to, but then we need to make sense in this journey. So this is my approach. Basically, I'm trying to see the big picture. I'm amazed also by the number of patients that go to some countries, for hair transplants. And in fact, nobody told them that they're going to need two or three hair transplants
Sessions.
along the course of their life. Yeah. Because, the problem is you do a hair transplant, but you continue to recess behind. And so, And so at some point it get weird. So, but I'm
Right,
amazed
right.
by the yeah, maybe you want some clinics. No, I'm kidding. No, but the but the point is like you don't have a simple shot answer, one answer. No, you need to be honest. I'm a straight shooter. I'm not sugarcoating anything with the patient. So I'm telling them right away, this is, can you allow me to tell you what I see, and then from what I see, this is what I would recommend. But then, if you want to do extra whatever, you will find someone to do it for you. If you want lips like this, face like that, but it's not my style. I would say the French touch, a little bit less visible. But like when you come to me for cosmetic reasons, everybody will ask you, "What have you done? No, you took like a month of holidays." This is what I want the patient to feel like, and the people around the patient will tell them that, because they will look them like
They will
them
see the change.
themselves,
Yeah.
but there is something nobody can put the finger on what happened to you. And that's exactly what it needs to be, because I think the age of overdone is over a little bit, because people are afraid of that nobody wants to look like a monster anymore. And now we know how to avoid that. So honestly, all of my patients, they never ask me crazy things. They just want to look themselves but fresh and like before, if possible, and long-term results. And obviously, the what makes sense on on a financial aspect too. And I think it's a combo of it's the same, recon and cosmetic. When in cosmetic you have non-surgical and surgical option, and it's a combo of both. And the problem, if you go to a med spa, you're gonna have a nurse of a PA doing fillers or Botox in an amazing way. I mean, a lot of them are very well trained to do that, but they will see your problems only with a non-surgical option. You go to see a surgeon only, not doing non-cosmetic things, not surgical things in cosmetic, like a plastic surgeon doing only facelift. The answer will just be surgical. So I'm a surgeon, medical surgeon, and then on top of that, I do both, because I use this both world to fix a lot of things. So this is where also to find there. But same, I train a lot for that, and I learn my craft with time. So that's what it is. We are a few doing it, but I'm not the only one, huh, but at all. But I think it really make a lot of sense, especially if you have done nothing on your face and you really want a journey that makes sense right away. I think this is the best move to go to see a surgeon that can do both things,
Both.
because yeah, you will have a great advice and a great journey ahead that is designed for you.
I like your journey analogy where you plan for the patient their uh, cosmetic, let's say, or aesthetic outlook over time. Because you don't usually hear this, because like a patient comes to you, I want a
Yeah,
facelift. You offer them the facelift, but you don't think of the results on the long term,
correct.
because over the years they might need another procedure, another refinement or fine tuning of whatever outcomes that they were hoping for. So that journey analogy of yours is like a great holistic approach.
Yeah, so you have the problem with that is you have to take time. You have to have an hour appointment. So all of my new patients regarding cancer, obviously, or regarding recon or cosmetic, if the front desk, the team at the front desk know why they are coming for, I always request to have a time with them. When I do facial feminization things, when you have to evaluate the full face from top to bottom, I need an hour because I need to understand who you are. So it make my colleague laugh. Like when I have fillers for lip, which is a classic first things people are doing, I take 45 minutes. And people
Yeah.
laugh, like, why are you taking so long with this patient? She just want the one syringe in the lips. And no, she don't want the filler in her lip. She wants to have the new job. She wants to get the new job, and so to get the new job, I need to tell her what to do. And it's not about just filler. Nobody comes, I want one syringe in my lip. No, I want to look good for a reason. That's why I'm trying to understand, because depending on the reason, the plan can change a little bit.
Right.
And so this is why it's taking time. But maybe I'm wrong there, but I'm not sure.
Well, I definitely a patient, when they're coming for something for their face, they want to be listened to, as you mentioned, and you need to know what is the reason that they're coming in, so that you offer them the best solution, because you might know what is better for them than what they think the original intervention was the best option, for the cause they were seeking.
Correct, correct. It's always about a fine balance, a fine tune for sure. And but I'm always trying to be honest. I think it's important. Also, it's not only that. So first, when you try to find someone that is your surgeons, I think you have to find someone that is obviously well trained first, because you deserve the best. You deserve someone that really knows how to fix you, or to treat you. That's really number one priority. But then obviously you need someone that care. And I think that's very rare, unfortunately, to really have someone that care. And you this is why you have to discuss with the patient, because you have to create this connection of trust. And I'm really trying to dedicate this time to find a good solution for them. But also, usually my sentence is, I know you said a lot to my resident or my PA about everything in your life, but I'm going to ask you again some question, because I'm going to fix our conversation like that. I'm going to remember our conversation like this, rather than just coming and what can I fix, so yeah, it's exactly like this.
Laurent, I think we had a blast in our conversation today.
Well, it was great.
I mean, the more I ask you questions, the more things that I want to talk about.
No, no, yeah, yeah. I mean, I can speak about that for days. No worries. I'm there. No, no, I understand.
Thank you very much for your time with us today.
It's a
I
pleasure.
really enjoyed every bit of the conversation, and I think we should meet again and talk more about all your other procedures that you fantastically do.
Oh, thank you.
Laurent, you're officially scrubbed in. Thank you for sharing part of your journey with us.
Thank you, Tarek. I appreciate it.
This is your host, Tarek, signing off. If you enjoyed this episode, ladies and gentlemen, don't forget to share, subscribe, and leave us a review. And as always, stay bold, stay curious, and stay scrubbed in.